And then second speaker is Dr. Divya Ragati, consultant endocrinologist at Haster CMI Hospital, Bangalore. Our topic is muscle matters, protein nutrition and supplementation in the era of GLP-1 and GIP therapies.
Okay. Hello, good morning everyone. So Dr. Rashmi has detailed about obesity being a chronic disease. Let us dwell upon a topic which is much related to the nutrition aspect of it, how the muscle matters and protein nutrition and supplementation in this era of incretin therapy. So we know that there's a rising burden of obesity and diabetes. It's the fastest growing chronic disease. The rates have tripled globally. 1 in 8 people worldwide have obesity, and this figure is projected to be as high as 51% of the population by 2035. The ICMR India studies of 2023 reveals almost more than a quarter have generalized obesity with predominant abdominal obesity. This thin fat phenotype is a major contributing factor in the Indian population. And with this adoption of GLP-1 receptor therapies and the rising obesity rate, the use of GLP is going to go up, and the increasing affordability and expanding availability are expected to accelerate the adoption of GLP-1 receptor-based therapy in India. So let us understand what exactly is this lean muscle mass. Lean body mass actually is the total body mass minus the fat which is stored in the adipose tissue. So it includes water, protein which is in the muscle and organs, minerals that is the bone, glycogen and essential organ fat. Why does it matter? Because our lean body mass, that is the skeletal muscle mass, it is required for the strength, mobility and the metabolism and overall health. In lean individuals, about 60% of this is water. However, in obese patients, it can be as low as 40% due to high body fat. This muscle preservation is the key, as without nutrition, that is with less of protein and this without resistant exercise, a proportion of lean muscle mass is lost during this weight reduction. As this is evidenced by the studies in STEP 1 and SURMOUNT trial. STEP 1 with semaglutide showed almost 38% of the total weight loss from the fat, from the muscle mass, And the similar thing with SURMOUNT 1, tirzepatide showed about 26% of the weight loss which is occurring from the muscle. So they do deliver substantial weight loss, but more than a quarter may be lean muscle mass, indicating a key concern for the muscle preservation. This lean muscle mass loss, it drives weight regain as well, because it lowers the basal metabolic rate and there is easier fat regain. And 67% of the patients regained weight after stopping semaglutide in STEP 4 trial, and a substantial regain, up to 14% of them had weight regain upon tirzepatide withdrawal in SURMOUNT 4 trial. This muscle loss is even more relevant in the Indian context because we have a lower baseline muscle mass. There is a habitual low protein intake in our diet. The high carb diet, it worsens the insulin resistance, and it is added upon by reduced physical activity. And with this GLP on board, it is reducing the appetite and lowering the food intake, particularly the protein. This muscle loss, it can cause short-term and long-term consequences during the incretin therapy. Short-term consequences may be increased risk of fractures, falls, and functional decline, metabolic deterioration in the form of insulin resistance getting worsened, the psychological issues, the risk of infection, and the poor quality of life. Long-term consequences also increases the predisposition towards cardiovascular diseases, stroke, CKD, cognitive decline, and retinopathy. So the early assessment and timely protein supplementation may prevent long-term consequences of this muscle loss. So what are the nutritional gaps in the Indian diet? We know that Indian diets are predominantly high in low-quality carbs and saturated fats, and they are low in protein. 62% of the energy comes from the carbohydrates, and predominantly the protein intake, which is low, it is also from a low quality source. Like 50% comes from the cereals, and there is a protein deficiency gap. The recommended intake is 15%, while the national intake was found to be around 12%. It is suggested to replace it with an isocaloric swap. 5% of the carbohydrate calories, if we replace them with a high quality protein, it is associated with a lower likelihood of metabolic risk. There are unmet nutritional needs in Indians. These are the findings of a cross-sectional study of around 1,000 adults with diabetes. 95% of them were aware about the importance of protein. However, only 15% met the protein requirement. And this dietary nutritional intake in patients who are on the therapy, it matters all the more because there is consistently reduced calorie intake. It may alter the protein, fat, and carbohydrate intake. Reduced macronutrient intake may worsen the sarcopenia or the lean muscle mass. And the reduced micronutrient intake can also worsen the underlying deficiencies like calcium, vitamin D, and magnesium, and the patient may experience relative dehydration. So we have to ensure that these certain recommendations are followed by the patients who are on these incretin therapies. Number one is a high protein intake, 1.2 to 1.5 gram per kg per day. It has to be taken per day and distributed across evenly across the meals so that we support muscle protein synthesis and reduce the catabolism during the calorie restriction. Along with that, equally important is targeted micronutrient intake of adequate calcium, vitamin D, magnesium, and omega-3 fatty acids, added with resistant training at least 2 to 3 sessions per day to mitigate that lean muscle loss. So there are certain key nutrients which are essential for the muscle health. Protein, including whey, it increases the muscle mass and muscle strength and physical performance. The branch chain amino acids, they promote anabolic signaling and they support muscle preservation and recovery. Micronutrients like calcium and vitamin D, they regulate muscle contraction, increase the lean muscle mass and muscle strength. Omega-3 fatty acids, they increase the anabolic signaling and decrease inflammation, wherein they support the muscle protein synthesis and increase lean mass and walking speed. Similarly, taurine, magnesium, B12, and carnitine, they all support the energy production and muscle recovery. So why protein is essential during weight loss? It prevents the muscle breakdown. It improves the satiety and thermogenesis. It maintains the basal metabolic rate. Muscle mass, it drives the resting metabolic rate. Preserving it helps prevent the metabolic slowdown, which often accompanies the weight loss. And it enhances the fat loss quality. Overall, the protein matters because of the increased signaling of these hormones and the thermic effect, which contributes to almost 25 to 30% of the calories. Whey protein isolates, WPI, are the gold standard for muscle preservation. Whey protein isolates are high quality protein because they have a high leucine content, up to 10 to 12%. It has got a better absorption and digestibility. The processing method, it reduces the lactose and fats, making it rapidly digestible and absorption, coupled with the essential amino acids of and the branch chain amino acid. It makes it particularly effective for stimulating the muscle protein synthesis. And it has got one of the purest form of protein in the market these days, and with a low lactose levels with minimum carbohydrates, so that lactose intolerant patients also can be prescribed this they can take whey protein isolate. So what is the evidence for it? Whey protein and resistance strength, they work synergistically to improve the muscle protein synthesis, lean mass, and muscle strength. So these are the findings of the meta-analysis, which show that the combination of whey protein supplementation and exercise, it significantly enhances the myofibrillar fractional synthetic rate as compared to the exercise alone. And another meta-analysis of around 21 RCTs with more than 800 participants spanning over 3 months, it revealed that in comparison to placebo training group, whey protein supplementation along with resistant training, it significantly improved the lean muscle mass by almost 0.5 kg, with reduction of the fat mass by 0.62 kg and improved muscular strength. So the key take-home messages are: the increasing burden of obesity and diabetes in India is adversely affecting the quality of life, highlighting the need for effective and substantial treatment strategies. The incretin therapy of GLP-1 receptor agonist and GIP induced weight loss, it is clinically significant, but we know that it is associated with a measurable reduction in the lean muscle mass. And this GLP receptor agonists effectively promote weight loss, but prevalent protein and micronutrient deficiencies in the Indian diet, it remains a major concern. Clinical evidence supports that protein supplementation, particularly whey protein, helps in preserving the lean muscle mass during weight loss and maintenance, with branch chain amino acids contributing to muscle protein synthesis. So the early consideration of protein supplementation along with GLP receptor agonist therapy or the incretin therapy, it may help mitigate the lean muscle mass and it optimizes the clinical outcomes. Thank you.
Thank you, Dr. Divya, for a wonderful insight about nutrition supplements. Now, any questions, please? No questions? Yeah,
Okay.
protein is one of the major supplements which is required as on today, because we Indians tend to consume lot of carbohydrate-rich foods rather than protein.
Correct.
Thank you.
Yes.
Thank you, Dr.
Thank
Divya.
you. Thanks a lot. Thank you.